Chest pain can be caused by a variety of reasons, including things like angina, heart attack, but we also know palpitations can also bring on chest pains. These are the worrying causes, but there are other causes as well. Things like acid reflux can precipitate chest pain. The chest wall itself can cause pain, so we know that the chest is made up of the breastbone and also muscles interspace between the ribs, so the pain can be coming from any of those sources. Chest pain can also be caused by the lungs as well, so that sort of chest pain is usually pain that is exacerbated when someone breathes in or out. But anxiety is another common cause that we see in patients as well. Chest pain is usually quite a worrying sign for patients. If you experience central chest pain, this is something that you should certainly be concerned about. Things that you need to be looking out for are the sort of characteristics of the chest pain. If the chest pain comes on in the centre of the chest, comes on suddenly and is made worse with exertion, then this might be indicative of pain of angina. And if this is the case, then this is certainly something that you should discuss with your general practitioner. If the pain, however, persists then and is associated with breathlessness, sweating, a clammy sensation, then you have to be concerned that this might be pain being caused by a heart attack. And in that case, I would always recommend that you let your loved ones know at home, and also ask somebody or maybe yourself to dial 999 and call for an ambulance. Pain of a heart attack or myocardial infarction, as us doctors call it, is pain that comes on suddenly in the centre of the chest. Patients usually describe a tight sensation, a band-like feeling in the chest. The pain usually spreads up into the jawline. It can occasionally go down into the left arm. Patients have also described pain radiating or spreading through into the back or into the right arm. The worrying feature of the pain is that the pain persists, so it can go on for 20, 30, 40 minutes, and if that's the case, then this is a pain that needs to be taken seriously. Patients usually complain of being short of breath at the same time. They may feel symptoms of sweatiness or clamminess. They may feel lightheaded or dizzy. And if this is the case, then I normally advise that patients dial 999 and ask for an ambulance to attend urgently, because they may be experiencing a heart attack and they will need to be transferred to hospital for rapid treatment for this. Usually what will happen is that your GP will refer you to a specialist depending on what your GP thinks is the most likely cause of the chest pain. If you are referred through to a cardiologist, then we will carry out further investigations to make sure that the chest pain that you're having is not pain of angina. Some of the tests that we would normally undertake would include stress tests, and this is a test that is designed to see what your exercise capacity is like and whether or not exercise will bring on some of the symptoms of angina. So the classical pain of angina is usually a pain in the centre of the chest, which is made worse with exertion and eased by rest. So having a patient exercise can bring out some of these symptoms and help with the diagnosis. Other investigations that we might carry out would include a CT scan of the heart arteries. This allows us to have a look to see if there are any potential blockages in the heart arteries supplying the heart muscle. And we may even consider doing a test called an angiogram, which is an invasive test but allows us to look directly at the heart arteries to determine whether or not there are any narrowings in the heart arteries. If your doctor diagnoses you as having angina, there are a variety of treatments that are available for them to administer. The first thing that they would normally consider is medication. There are medications which are designed to dilate or increase the blood flow to the heart muscle. These medications, include things like sublingual GTN spray. There are other treatment options available as well, so if you've had an angiogram done and the doctor has found that there are narrowings in the heart arteries, they may consider sending you forward for a procedure called an angioplasty. This involves passing a small wire into the heart and dilating any narrowings with a balloon, and usually then deploying a stent, which is a metal meshwork, to allow blood to flow normally. If there is extensive disease in the heart arteries, then your doctor might consider whether you need to have a bypass done. This is usually a procedure that's done under general anaesthesia and is an open heart procedure. Aside from this, there are other medications that are useful. We know that statin therapies particularly can help stabilise any narrowings in the heart arteries, and this is usually a treatment that would be given to you along with aspirin, which is a blood thinner and allows the blood to flow more freely in the heart arteries.